Hello everyone, my topic for paper is efficacy of the Adnex MR scoring system for assessment and characterization of Adnex masses with histopathological correlation. My co-authors are Dr. Harini ma'am she is a professor from Department of Radiodiagnosis, Sri Devraj Aras Medical College, Kolar. Introduction. Adnexal mass is one of the most common gynecological diagnoses with more than 80% of benign origin. Every year, about 2.5 lakh women worldwide are diagnosed with adnexal lesion masses. Ovarian cancers and other adnexal malignancy together is the seven most common cause of death among women. Adnexal masses are the most common findings found on the routine investigation like USG MRI. Although USG is the first line modality for the assessment of suspected adnexal masses, it yields indeterminate findings in approximately 20% of adnexal masses. And pelvic MRI is considered as gold standard in differentiating benign and malignant lesion. The aims of the studies is to assess the role of MRI and adnex MR scoring accuracy in differentiating from benign from malignant adnexal masses, to investigate the prognostic value of adnex MR scoring in the preoperative management of adnexal masses with HPE correlation. Uh, Methods type of the study is prospective study. Study population, patient refers for MRI pelvis in view of adnexal masses for diagnostic evaluation to the Department of Radiodiagnosis. Study will be conducted at RL Jalapa Hospital and Research Center. A structure of pre-prepared proforma containing the patient details, clinical history, physical examination, and investigation who meet the inclusion criteria will be subjected to MRI. Sample size is 34. Inclusion criteria: patient with clinically or ultrasonographically suspected adnexal lesion will be included in the study. Exclusion criteria are claustrophobic and uncooperative patient with magnetic implants, pacemaker, cochlear implants, and aneurysmal clips. MRI scan will be performed on 1.5 Tesla 18-channel MRI machine in the Department of Radiodiagnosis. A total of 34 patients will be included in this study and informed consent will be taken. Following image sequence will be used, that is T1 axial coronal, T2 axial coronal sagittal, stir coronal, gradient recall, echo axial oblique, post contrast T1 weighted image. After the MRI scan, findings of the same and diagnosis will be recorded in the proforma. Patients who are willing to go under will be included in study, and MRI findings of those patients will be correlated with HPA findings. Result of the studies: total number of patients included was 34. Mean age of the patient is 55. Range of the patient is between the 32 to 70 years of age. This is the bar diagram of the age distribution, in which most of the cases found in the 50 in between 50 to 61. This is the pie diagram of the size of the lesion, in which most of the cases found in between the 5 to 10 centimeter. This is the pie diagram of benign and malignant, in which most of the cases found to be malignant. This is a bar diagram of T1 intensity, in which most of the cases are iso-intense. This is the bar diagram of the T2 intensity, in which most of the cases are heterogeneous on T2 images. This is a bar diagram of T1 post contrast intensity, in which most of the, like all cases are found to be heterogeneous on T1 post contrast. This is a bar diagram of Adnex MR scoring system, in which most of the cases are in found to be Adnex of 5. This is a bar diagram of MRI and HP correlation, in which most of the cases are malignant, and one case is found to be benign from malignant in histopathological correlation. This is case 1. This is a T1 axial and T2 axial, in which T1 shows iso-intense lesion and T2 shows hyperintense lesion. On post, this is a this is a T1 sagittal section, in which peripheral enhancement is seen in T1 post contrast images. On histopathological, they have given in mucinous cyst adenoma of the right ovary. Case 2. This is T1 axial and T2 axial, in which iso-intense lesion is in T1 and hyperintense lesion is T2. This is a DWI and ADC, in which restriction of diffusion is seen on DWI. This is T1 axial contrast image, in which peripheral enhancement is seen. On histopathological, they have given benign ovarian tumor adenofibroma. The result of these studies are there were 34 participants in the simple sample. Patient with clinically or ultrasonographically suspected adnexal lesion included in study, and MRI findings of those patients will be correlated with HB findings. According to the data gathered from affirmation subjects, the study revealed the accuracy of MRI was about 93% in identifying the malignant and benign lesion. The present study of adnexal masses shows strong positive correlation between MRI and HB findings. Coming to discussion pad, adnexal mass refers to growth and develops in the female pelvic organ. It occurs near the uterus, usually in the ovaries, fallopian tubes, or connective tissue. According to Dr. Ann Hotted et al., the Adnex MR score provides a stratification system for assigning the probability of malignancy to adnexal lesion based on MRI features using a stepwise approach. The benign tumor is estimated to be around 40 to 50% in menopausal women and around 7% in women with childbearing age. Adnexal mass is a common gynecological diagnosis occurring in about 1 in 10 women throughout their lifetime. Early diagnosis and accurate staging are crucial for specific patient management. Pelvic ultrasound is also the primary imaging modality for examining adnexal masses. This is the Adnex MR scoring system which is used in the studies. Adnex 1 is referred to patient without mass. Adnex 2 is benign masses. Adnex 3 masses that are probably benign. Adnex 4 are indeterminate MR masses. Adnex 5 probably malignant masses. Conclusion of the studies is this is MR Adnex scoring system. Simplified MRI protocol is a great value in the standardization of MRI emulation and reporting for adnexal masses. MR imaging can further assist indeterminate or incompletely evaluated adnexal lesion discovered on ultrasound with a high sensitivity and specificity for the diagnosis of malignancy. Histopathological were used as a standard reference for evaluating the validity of adnex MR scores for detecting adnexal lesion. These are my references.